Chronic pain can do more than just cause discomfort. It can actually trigger metabolic diseases. Dr. Jordan Axe from Root Cause Medical Clinic is back to discuss this along with treatment options. Good to see you again, Doctor.
Thanks for having me.
I love that this is kind of your passion. You know, you and your family and your team have kind of lived this. You know what chronic pain can do for people, for their quality of life.
Absolutely.
This is why you're in the business you're in, to help change people's lives.
Yes. It's a big deal. Like, people are in so much pain and they think, I'm just going to ignore it, right? I'm a macho man, just I'm going to take some pain.
It'll eventually go away.
Exactly. But we don't realize is that's driving metabolic disease like diabetes, chronic fatigue, and we don't relate the two. But if people get out of pain, these things get better. Well,
and I'm assuming when you're in pain, that's your body telling you, hey, something's not operating right, something's going on, something needs to be fixed.
Yeah. Because think about it, if you're in pain and you're really stressed out, you're not going to digest food well.
Yeah.
Your body's like, I'm worried about the pain, not digesting my food and getting healthy.
Well, let's talk about some of these specifics and some of the things, I guess maybe are these maybe the more common reasons why people come and see you. Let's start with migraines. I feel like we hear this a lot.
Yes, this is a big deal, and there's not a lot of great treatment out there for it. One of my favorite treatments is called cervical vibrating traction, which I think we have a picture of that. And that actually vibrates at 4.5 hertz. And that frequency helps rebuild ligaments and discs in the neck that cause headaches and migraines. So again, we're getting to the root cause, and we're actually fixing the tissue that is generating the pain.
All right, next one up is sciatica. Is that nerves? Is that, what is that?
Yeah, sciatica and low back pain. So if you entrap the sciatic nerve, then it shoots all the way down your leg. And
Lovely.
it's the, and it's the disc in the low back that causes that. And you always have to ask yourself, if a cut heals in a couple days, why are my discs not healing? Why do I still have sciatica? And it's because there's hardly any blood supply. So if we could get the same amount of hydration and nutrients, your disc would heal just like a cut on your hand. So flexion distraction, which I believe we have a picture of that as well, we actually flex and distract, and that pulls hydration and nutrients into the disc. And if we can do that over time, you'll get out of low back pain, and the sciatica will start to go away because we've actually fixed the issue.
Knee and shoulder pain, this is another big issue.
Yeah, and this is a big issue too, because if your knees hurt, that's going to affect your low back and all the way up the spine. So two great treatments out there are platelet-rich plasma, right? That's what the athletes do, right? They get injured in like 2 weeks, they're like playing basketball again. What you do is you take your blood, you super concentrate it, inject it into the joint, because again, there's no blood supply to those tissues. So if we concentrate your blood and put it in there, it will heal again like a cut would. Well,
and what I love about what you and your team are doing, you're looking at medicine, you're looking at injuries, just I think a little bit differently than what traditional medicine is doing, correct?
Yes, absolutely. Again, our bodies are amazing. They can heal so quickly. You know, stem cell therapy is a great example. We went from 2 stem cells to you and me. And that's why stem cell therapy is great with, you know, regenerating the body. It's another great treatment.
What's your take home as we close? We have about a minute left. What do you really want people to understand?
That pain is a big deal, right? And if you can get out of pain, you can start moving, you can start exercising, you can start eating better. And again, it's a big deal. So, you know, anyone that wants to come into the office, we do for the first 15 to 20 callers, we'll do a free appointment and first treatment. Again, I care about getting people better, getting people out of pain, not just the money. I want to see if I can help you first. I want to see if you're a candidate for PRP or stem cell.
Well, and let's talk about that. I want to make sure, because again, no two patients are alike. We can't do any guarantees on this show that this is going to solve all of your medical problems. But it's nice to get that started and figure out where you can go from here.
Get an opinion. Let's see what your options are first.
Doctor, so good to see you again as well. Thank you for offering that special offers for our viewers, and we look forward to seeing you again soon, okay?
Yes, thank you so much.